Hello everyone, my name is Dr. Marty Kotler. I'm the president of Target Coding. Thank you for attending this presentation. This is part 2 of a 2-part series on our topic of Box 21 of the 1500 Health Insurance Claim Form. So let's continue now with category ranking or hierarchy. Many reliable sources within our chiropractic industry, including me, feel that each position in Box 21 of the 1500 form should fall within a categorical ranking. For example, Position 1 should be neurological, Position 2 structural, Position 3 functional, Position 4 is soft tissue diagnosis, and all other unspecified or non-elsewhere classified conditions. Now remember, Medicare, on the other hand, requires that positions 1 and 3 contain subluxation codes, or Medicare sometimes calls them primary diagnosis codes. And positions 2 and 4 contain secondary diagnosis codes. Again, this is according to Medicare. So these secondary diagnosis codes, or some people call them the medical diagnosis codes, are placed in position 2 and 4, and they attach to the primary subluxation codes. Now, these are sometimes looked as short-term treatment codes, moderate-term treatment codes, and long-term treatment codes based on the expected length of time that these diagnosis codes will take to correct, or these conditions to correct. Some people call them DRGs, diagnosis-related guidelines. So based on my experience with hundreds of offices that I've worked with over the last 9 years, I feel that the following hierarchy is the most efficient. Position 1, neurological and pain syndromes. Those are the codes that have the highest value. Position 2, subluxation. Position 3, structural functional. Position 4, unspecified conditions, muscular conditions, congenital or anomalies. But this is important. Do not use certain diagnosis codes just because they will increase the amount of reimbursement. You need to use diagnosis codes that accurately depict the patient's presenting complaint and underlying condition. Again, try to use as many high-value codes as possible in Box 21. So let's go through an example. Emily Smith walks into your office. She's been to medical doctors, physical therapists. She has a problem where she had some trauma. She fell. She fell off her bicycle. I'm just creating a scenario right now. Give you a practical example. Emily's riding her bike. She falls. She lands on her shoulder. She doesn't hit her head, but she jolts her head pretty hard. Gets up. She feels neck pain, shoulder pain, pain radiating down her arm. Goes to the medical doctor. Goes to a physical therapist. She's getting treatment, but it's not working. She's recommended to get an MRI. MRI shows a herniated disc. She's tried a lot of things, and now she shows up into your office. And now you come up with herniated disc, post-traumatic headache, muscle spasm, muscle weakness, neck pain. You take x-rays, you find disc degeneration, subluxation, radiculitis, shoulder pain. Wow, a lot of stuff going on. We have 9 diagnoses. Now, you may be thinking, wait a second, that's a lot of diagnoses. Well, you know what? Just list what the patient has. There's nothing wrong with that. Now, we have Box 21. There's only room for 4. There's 9 on this list. Which 4 do we choose? We want to choose codes that have the highest value. Now, here, let me give you an example. Let's say there was only 1 space in Box 21. Patient walks into your office with sciatica and subluxation. If it's not Medicare, which one are you better off using? In my opinion, sciatica. It'll paint a better picture as to what's going on. with the patient, and it'll have a bigger impact to the insurance company, and you'll get paid for more visits. Another example, let's say the patient has a herniated disc in their neck and cervical sprain or muscle spasm in the neck. Which one should you put? If you only could pick one, you're going to use the herniated disc, right? Because it paints a better picture. So you have a list, get good at this, get knowledgeable at this, learn how to choose the best codes for Box 21 based on the patient's clinical presentation. Now, this is interesting. Box 21 and 24E, they need to be communicating and talking to each other. They're related. You know, 24E is where you put the number, the diagnosis pointer number, which points to the code in Box 21. So become aware of that, and not doing this properly or not allowing these two boxes to communicate with each other can cause claims to be denied, and you might not even know why. There's where it gets frustrating. This presentation is being sponsored by rehabsupplies.net. Check them out. You'll get great discounts on back braces, TENS machines, pillows, BioFreeze, electrodes, and much more. The website is www.rehabsupplies.net. Telephone number is 1-800-656-3730. So now what I would recommend you do is create a pointer form, a diagnosis pointer form. This is a form that I created in my practice. It was a great tool where across the top I had cervical 1, thoracic 1, lumbar 1. Those were the highest value codes. Then I had cervical 2, thoracic 2, lumbar 2, cervical 3, thoracic 3, lumbar 3, cervical 4, thoracic 4, lumbar 4, and after every exam and re-exam, I would put the patient's name on top, the date, and then I would just check everything that the patient had, every diagnosis. You know, neck pain, some people say, is that really a diagnosis? Isn't that a symptom? Well, there is an ICD-9 code for neck pain, so I'm going to use it. I'm just going to check everything that the patient has. I'm not going to check diagnoses that don't exist. I'm not just going to pick diagnosis codes because I think it's the right code. I'm not just going to pick diagnosis codes because I know they'll get paid better. I'm going to make decisions on what diagnosis codes based on the patient's clinical presentation, history, exam, x-ray findings, and other diagnostic tests. So create a form like this for your practice so you can just check away, and then you hand this form to your staff member, and then all they need to do is just follow the check marks and the position numbers, and then they'll be able to enter these codes into your system so it can go out electronically or on paper in the way in which you want the claims, the diagnosis placed in the claims, the highest value codes in Box 21. So now look, Emily comes back 12 visits later. She's doing a lot better. She doesn't have any more headaches, no more muscle spasm, no more weakness. She's doing better. No spasm. She doesn't have pain down her arm, no more shoulder pain. She still has a herniated disc. Her neck is still bothering her. Not tremendously. It's better, but it's still there. She still has subluxation. She still has disc degeneration. But now she comes in and says, you know what, Doc, I woke up this morning and went down to tie my shoes, and I feel a little lower back pain now, which she never had before. So now you have 5 diagnoses. There's only 4 spaces in Box 21. You'd need to learn, okay, which 4 are going to be the best to use in Box 21. And I've written a guidebook. It's called the Guidebook on the Best ICD-9 Codes to Improve Reimbursement. And this guidebook takes you through these scenarios. It will show you what are the best diagnosis codes for each position based on the condition, based on neck problems and neck problems with upper extremity involvement, thoracic problems, lower back conditions, and lumbar conditions with lower extremity involvement, Medicare, and that diagnosis pointer form that I was relating to. I'll show it to you again. This form, this is page 31 of the guidebook that I wrote on the best diagnosis codes to improve reimbursement. It's a great book to have as part of your library, and it's one of my top bestsellers. Now here, look, here's a Medicare example. Patient comes in, Medicare patient comes in. We need to use the Medicare primary diagnosis codes of subluxation, and then we have a few secondaries here. So we have lumbar subluxation, cervical subluxation. Those are the primaries. Then lumbar disc degeneration, 722.52, low back pain, cervical disc degeneration, neck pain. So we have 6 diagnoses here. Again, there's only room for 4. Medicare requires subluxations in 1 and 3, and the associated diagnoses, the secondary diagnoses in 2 and 4. Now we have a choice. Lumbar subluxation is associated with lumbar disc degeneration and low back pain. So which out of those 2 should I use? Should I use disc degeneration or lumbar pain? Well, disc degeneration is considered more of a longer-term treatment code, so I'm going to use that. Low back pain is in the notes. All the diagnosis codes remain in your notes. You're just going to use the best for box 21. So if you'd like more information about this guidebook on the best ICD-9 codes to improve reimbursement, please contact us. There should be a little envelope on your screen or a share button, an email, info@targetcoding.com if you're interested in purchasing this book. If you put code 674 in the subject line, then we'll take $10 off the normal purchase price. And if you purchase the book, we'll email you page 31, that diagnosis pointer form. We'll email you that form in MS Word file so you can modify it and customize it. Now that's a special just for listening to this presentation. Put code 674 in the subject line. You'll get $10 off the purchase price, plus we'll email you page 31. Please do not request page 31 of the book without purchasing the book. You have to purchase the book in order to get page 31 emailed to you. So this guidebook will help you learn powerful, cutting-edge information that will help skyrocket your case values and optimize reimbursement. And we guarantee you'll be satisfied with this guidebook. Purchase the book, look at it. If you're not happy with it, just send it back, and we'll give you your money back. It's one of my best-selling guidebooks. The other best-selling guidebook, I've written 8 books on chiropractic billing, coding, and documentation. What you see on your screen are the 2 of my best-selling guidebooks. The other one is on the best CPT ICD-9 coding combinations to improve reimbursement. And I'll be doing a presentation on that book in the future. But all the information is on the website. And if you'd like to contact us, here's our contact information. The email address is info@targetcoding.com. Website is targetcoding.com. Telephone number 1-800-270-7044. We offer membership services, online trainings, DVDs, guidebooks, webinars, and much more. So I want to thank you for listening to this presentation. I hope you learned a lot. Take care. Bye-bye.